Hello, my name is Abigail Davis and I'm a nursing student here at the University of South Alabama. Today I'll be performing my injection site checkoff. Here's my badge. And then Hannah is going to pan the room. Okay, so the first ones that we're going to start out with are the intramuscular injection sites. So with IM, you're always going to aspirate for blood and they're always going to be given at a 90-degree angle. So the first one that we're going to look at is the deltoid. So you're going to come right here. The first thing you're going to look for is the acromion process. And then the next thing you're going to look for, you're also going to make sure the patient's arm is relaxed. The next thing you're going to look for is where the deltoid meets the humerus. So you're going to go 3 fingers below the acromion process and 3 fingers above where it meets. You're going to create a V with your fingers and you're going to inject it at 90 degrees right in the middle. Okay, the next one that we're going to do, you're going to lay on your side. This is going to be your ventrogluteal. So for this one, you're going to find the greater trochanter. You're going to be able to move the patient's leg to feel it. So hers is right here. You're going to place the palm of your hand on the greater trochanter with your thumb facing towards the pubic region. Your index finger is going to face towards the anterior superior iliac spine, and your middle finger is going to face towards the iliac crest. You're going to palpate this area right here to make sure you're on top of muscle and not on top of a bony prominence, and then you'll be injecting at 90 degrees right in between your index and middle finger. Okay, so the next one I'm going to get you to lay on your back. This one is going to be your vastus lateralis. So it's going to be right here. You're first going to find the greater trochanter. So it's going to be right here. You're going to go 1 hand's breadth below the greater trochanter and 1 hand's breadth above the knee. So now you're going to be creating a rectangle. You're going to want to make sure that you don't go past the midline of the inner thigh or past the midline of the lateral side. So you're going to be working with right here. So when you're right here, you're going to inject the needle at 90 degrees right there. Okay. So the next ones that we're going to do is the subcutaneous. With subcutaneous injections, you're not going to aspirate for blood. You're either going to inject at 90 or 45 degrees. If you can pinch more than 2 inches of skin, you'll inject it with 90-degree angle. If you can pinch 1 inch of skin, you're going to inject with a 45-degree angle. So the first one that we're going to look at is the vastus lateralis. Like I mentioned before, find the greater trochanter. You're going to go 1 hand's breadth below the greater trochanter, 1 hand's breadth above the knee. Find your rectangle. Make sure you don't go past the midline of the inner thigh or past the midline of the lateral side. So you're going to inject 45 to 90 degrees, or 45 or 90 degrees right here in this area. Okay, the next one that we're going to do is the abdominal. So I'm going to lift your shirt up. You're going to want to make sure that you stay away from the 2-inch border around the umbilicus. You're also going to make sure that you don't go above the intercostal space or below the pubic region. You're going to also want to make sure that you stay in between the anterior and superior iliac spine. So with that being said, it's going to create a U shape right here. These are good for reoccurring subcutaneous injections such as insulin or heparin. Okay, the last one that we're going to look at, I'm going to have you sit up. To pull down your shirt right here to expose your upper arm. So you relax your arm. Now this one, you're going to look for where the deltoid meets the humerus. You're also going to look at the olecranon process. All right, so you're going to do 3 fingers below the attachment site and also 3 fingers, above the olecranon process. This creates a rectangle right here, and you're going to inject either 45 degrees or 90 degrees within the rectangle. And this completes my injection site checkup.